of the questions I get a lot is, why do I need a facelift in 2013? Can't you do it with injections or fillers? Well, there's still a role for skin tightening and lifting with surgery. But let me try and put it in perspective with the issue of volume versus tightening of the skin, because they do go hand in hand, and many times you can get away with one without the other, but many times it's a combination. So let's talk first about volume, because as we get older we lose volume in our face. We can lose volume in our cheeks and around our eyes and in the neck, and it allows the skin to basically deflate or sag. So many times, depending on the age and the stage of the individual, a filler such as fat, or one of the fillers off the shelf such as hyaluronic acid, which are basically Juvederm and Restylane, or Radius, which is a calcium hydroxyapatite lattice work that you inject, or Sculptra, which is basically just the soluble version of a suture material, all can fill and restore volume. And how you choose which depends on the surgeon you see and depends on your anatomy and the expectations that you have. So in many cases, youth can be regained in the face with just volume restoration. But in some cases, it's just simply not going to happen. So now that we've kind of described the list of the options of the fillers that we have, let's look at a photograph of a patient and go through the options that this particular patient has as an example. In this particular patient, we can see that there's volume loss in the temple, there's volume loss around the eyes, there's certainly a little volume loss in the cheek and the nasolabial fold, and in the crease at the corner of the mouth. The neck, of course, has loose skin. So in this patient, what options do we have to restore volume? Well, certainly a facelift or a tightening procedure won't restore volume to the cheek. It may improve the corner of the mouth by pulling the tissues, and there's really nothing you can do in the neck to restore volume. So we have the area around the eye, which, although you could do surgery to fix this area, certainly some filler here might improve the appearance, but it's more temporary, and certainly the temple. So the areas of volume loss in patients are, again, typically the temple area where we tend to get hollow, around the eyes, the cheek, the fold, the nasolabial fold, the perioral area, and of course we haven't even discussed the fact that the lips start losing volume, and as the lips lose volume as we get older, the mouth and the face looks older because we've lost that volume, that fullness that is youth. And of course in the jawline there's a little indentation here that sometimes can be improved. But in this particular patient, if we carry this out, certainly the best option is a facelift, because the difference in her appearance is dramatic. And the reason for it is, yes, we put some volume here with some fat, we restored the jawline, we filled the lips with hyaluronic acid or a filler, we did not do anything to the temples, but we did the eye surgery and restored fat to the lower eye. And as you can see, there's a pretty dramatic difference in the youthfulness in this particular patient. It's basically 1 year after surgery, and it includes the volume restoration and the tightening. When you look at patients who need volume restoration and tightening, you have to look at them in the total realm of what one option can achieve versus what the other option can achieve. In many cases, the current thinking is, well, we have fillers and we have needles and we can just simply restore all youth with fillers. And most of the time that's propagated by the concern that, well, surgery is dangerous, surgery is not going to yield a nice natural look, and of course that's not entirely true any more than volume will restore a natural youthful look in every case. So what you want to look at is, what is your expectation? What is your goal from the surgery? And if you can reach that goal with volume restoration, then that's great, because there's usually a little less downtime. But if you can't achieve what you expect out of the treatment with just volume restoration, and there's enough aging, many times you simply have to do skin tightening with a type of facelift or a improvement of the neck or the jowl, which sometimes requires surgery. Ironically, many times the filler will be a longer recovery than a well-executed mini facelift or minimal facelift. So you have to keep that in mind too. The key is making sure you get second opinion, third opinion, and get the information you need to make a good decision.